Hello, I'm Rico Cavella. Welcome to this episode of Fearless Aging, where in every episode, my guests and we strive to offer you proven tips and strategies that you can implement immediately to greatly improve your overall health and well-being. So we're here to inspire you and empower you to become your best self so you can go out and make a bigger positive impact in the world. So before I introduce our episode today and our expert guest, I have a question for you. If you've been wondering how well you are aging, I have the solution for you. You can go to our main website, agelesslivinglifestyle.com, and take our free aging assessment. And if you don't like the results, you can book a free call with me and we'll discuss what challenges you're having, and I'll give you some quick and easy solutions that you can implement immediately. So I'm real excited about today's show. It's such an important one. It's entitled Fracture Proof Your Bones, a comprehensive guide to osteoporosis. And our guest today is Dr. John Neustadt. He's a naturopathic physician. He's the founder and president of Nutritional Biochemistry, Inc. He earned his naturopathic medical degree from Bastyr University, where he was awarded the Founders Award for Academic and Clinical Excellence. He has published more than 100 medical articles, written 4 health and wellness books, and is now a #1 Amazon bestseller in the field of osteoporosis. And his most recent book is the title of our show, Fracture Proof Your Bones, a comprehensive guide to osteoporosis. So this is going to be a really informative and beneficial show. So Dr. John Neustadt, thanks so much for being here.
Thank you.
Yeah, it's my pleasure. This is such a subject that we haven't really covered before, so I'm really excited to get into it. So I think maybe we should start with, in case any of our audience is not real clear on what a naturopathic doctor is, give us a brief description of that.
Naturopathic doctors attend 4-year medical schools, accredited medical schools, and then pass 2 board exams, a basic science board exam, and then after the 2nd year, similar to medical doctors and DOs, and then after the 4th year, clinical exam. And when we do that, we're able to then practice in the states in which we're licensed. Our education is different, though, than the conventional medical doctors and DOs in the sense that we are taught from the beginning to think holistically, to think integratively, to treat the whole person, and to strive to the best of our abilities to understand and treat the underlying cause instead of just symptoms. So we're taught pharmacology and cardiology and all of the standard ologies that any doctor has. But then we're also taught nutritional medicine, 5 quarters of nutritional medicine, looking at the biochemistry of nutrients and how they work in our body, looking at botanical medicine and botanical extracts, we had classes on physical medicine or, similar to chiropractic type adjustments, counseling, and the list goes on and on. So it is really fundamentally also different in the sense that we are taught not just to grab a medication. We are taught that when it's appropriate to start with the least intervention possible, which for many chronic diseases, which so many people are struggling with, it is often appropriate to start with foundational type of approaches like diet, lifestyle, supplementation, sleep, things like that to try and correct the imbalances going on in the body and create that foundation for long-term health. And yes, of course, if somebody needs a medication, if somebody needs a hormone, then that can be prescribed as well. But it's not the only tool that we have in our toolkit.
Yeah, really well said. John, the message I always try and get out, we've got things turned around here, how between allopathic medicine and holistic medicine, what you offer, it should be the mainstream medicine. And then allopathic medicine, it's great when they have an acute situation, they can save your life, right? But that should be an alternative. Drugs and surgery should be an alternative, and mainstream medicine is what you offer.
And it's what the research supports. So if we're talking about just osteoporosis, bone health, which is a subject of this talk, I think this is a great example. And there are examples for cardiovascular health, neurological health, across the board for every chronic condition. With respect to bone health, what we know is that the bone density test, and that's really what people are testing and monitoring and tracking, only predicts 44% of women with osteoporosis who will break a bone and only 21% of men. And yet that's the number on the test is almost exclusively what patients focus on because they're taught to focus on that and what conventional doctors track. And they give the false sense of hope to patients that they are protected when that number goes up, when in fact, every medical association and organizations that have looked at the data have correctly concluded that fracture risk, which fractures are the most dangerous thing with frail bones, fracture risk depends on factors largely other than bone density. And it's those holistic approaches and a customized programs that can be created for patients that is based on what the research shows in the different areas of health or domains of health that are associated with decreasing fractures and improving bone strength in those populations.
Let me ask you, why you got involved with, and I'm really interested in writing a book about osteoporosis. How prevalent is it? How big of a problem is it in our society?
Hold on a sec. There's an earthquake.
Whoa.
Did you feel it?
Yeah, I'm shaking over here. Holy
Yeah.
moly.
Alarm's going off. I gotta stop.
Yeah.
I got alarms going off here.
Okay, hold on for a second.
Yeah.
Wow.
Hold on. Let me go check on my wife. Just hold on a
Okay,
second.
sure. Wow. That's something that we rarely have in San Diego is earthquake, but boy, I felt it. It was shaking here. So hang on here.
Stop an interview.
Maybe we'll be okay. Maybe we can come back and keep this show going. Yeah, I was actually shaking in my chair here.
Yep. Yeah, we're all right.
Okay.
Everybody's all right.
All right. We'll keep rolling then. That
Yeah.
was unique. I haven't done a show with an earthquake before, so that's pretty good.
That's unique. But you
Yeah,
know what? The diagnosis of osteoporosis is an earthquake in people's lives.
that's
It shakes them to the core. It wakes them
mhm.
up and it makes them understand that there is a scary situation that they need to address. And that's what happened to me and my family.
Uh-huh.
About 20 years ago, when I was a baby doc in practice, my mother-in-law had osteoporosis. She just passed at 93 a few months ago, and she was seeing her medical doctor. She was on Fosamax, and I was helping her just ancillarily, on the side with some diet recommendations and some health exercise tips. Her bone density was going up. So her physician was happy. She was happy, and I was happy because that's all I knew at the time. But then she fell on a throw rug in her house and she fractured her hip. And I thought to myself, something is wrong with this picture. So I dove into the research. I started reading. I started trying to understand this condition more. And I was shocked at what I learned about the limitations of the bone density test. As I already mentioned, it only predicts 44% of women with osteoporosis who will fracture and only 21% of men. And yet that is almost exclusively what is tracked. And it's giving, as I just said at a medical conference I gave a talk at last week, that this not only is this condition undertreated because officially there are about 50 million women and men at risk or for bone loss or with bone loss, but those who do have it, they're being mistreated because it is just that typically that bone density test that's being evaluated for success or if we're on the right track, and they're not looking at the patient sitting in front of them. They don't have the question and the focus on fracture reduction and thinking holistically.
Hmm. So talk about what exactly is osteoporosis and then some of the main causes.
Osteoporosis is a bone condition where bones are getting weaker and it is increasing someone's risk for fractures.
Hmm.
There is the diagnosis of osteoporosis is based on the bone density test. It's an x-ray test. And once somebody has that diagnosis of osteoporosis, they are typically, or even before, typically recommended a medication. The biggest risk for osteoporosis is in aging women as we get older. The 80% of cases occur in women and 20% in men. Women, when they go through menopause and there is a drop in a decrease in estrogen, and for the 10 years after, that's the fastest rate of bone loss in women. For men, what happened is men can go through andropause. They can have a decrease in testosterone as they get older, and that is a risk factor for bone loss in men. But there are lots of hidden risk factors that are going unrecognized. One of the biggest ones is the problem with people on different medications. Mm-hmm. The American population is one of the most medicated population per capita in the world. And there is a long and growing list of medications that damage bone and increase fracture risk. Some of the most common ones, for example, antidepressants, anything that artificially raises serotonin. We now know that a woman on an SSRI like Lexapro, Prozac, for more than a year, for every 19 women on that medication, one will break a bone. Wow. Or acid blocking medications. Tens of millions of people take proton pump inhibitors, and those also increase the risk for fractures. We're talking 60, 80+% increased risk for fractures compared to people who don't take those medications. Wow. Then there's the risk of diet. People following the standard American diet and eating lots of ultra processed foods. That's now associated with osteoporosis risk. Living too high of a stressed lifestyle, which a lot of people are, even people who are in the normal level of cortisol on a blood test, and cortisol is one of our stress hormones. Even in the normal range, those who are towards the higher end of normal have faster bone loss. People who have a lot of, have other diagnoses, that is a risk for what's called secondary osteoporosis. So any chronic inflammatory condition like irritable bowel disease, ulcerative colitis, cancers, autoimmune diseases, the list goes on and on. All of those are also risks for osteoporosis, and the majority of people are not getting screened for it. Even just in the general population, where you have Medicare eligible patients like 65 years or older, that's the prime demographic for age-related osteoporosis. 95% of those patients aren't getting screened with a bone density test. And if you have osteoporosis and you're a woman and you fracture a hip, there's up to a 36% chance that you're going to be dead within a year. And in fact, the risk of dying from an osteoporosis fracture is greater than the combined risk for all the different types of breast cancers put together. And a woman's risk for an osteoporosis fracture is equal to her combined risk of breast, uterine, and ovarian cancer. So this condition is really something that a lot more people, I think, have than they realize. And there are a lot of risk factors that doctors are not screening for that I talk about in my book, but that people should be aware of. And they're going to need to be, unfortunately, very proactive about educating themselves and bringing these questions to their doctors. In fact, in my book, at the end of many of the chapters is what's called the Take Action section, which lists questions for them to ask their doctors to make sure they're getting the right recommendations, to make sure they're getting the best care. Because, and this next statement is not my opinion, there was a study that came out looking at why this is so mistreated and undertreated. And the conclusion is that doctors are confused. There is no specialty like a cardiovascular disease specialist, or there's no board certification in osteoporosis or even integrative approaches to bone health. And doctors just don't understand how to interpret the tests. In general, it's the general practice doctor, the GP, family physician, who is the gatekeeper for referring and testing for osteoporosis. And there's confusion about how to interpret the tests, what the best medications would be in different situations. They don't understand the research and aren't trained to have the more nuanced and longer conversations around diet, exercise, and lifestyle, nor do they have the time, because of the insurance reimbursement model that is forcing them to have shorter conversations and see a larger volume of patients.
Well, let me ask you. Well, first of all, I just want to mention, I've read before that there's some studies that show that like Fosamax can actually be detrimental for your bones. Is that right?
That is true. So all of that is a category of medications called bisphosphonates. And the bisphosphonates, as well as other medications like Prolia, denosumab, Xgeva, Tymlos, all of those can create what's called osteonecrosis of the jaw, where your jaw, when you just have a simple procedure like a tooth extraction, that the jawbone can begin to literally start to disintegrate.
Wow.
And with the oral bisphosphonates, they can cause and create what's called an atypical non-traumatic fracture, meaning they create more bone. The bone density test will go up, but they create weaker bone, less healthy bone. And there are case reports, many in the medical research, medical literature, showing that even as innocuous as a woman who was watering a plant stepped down off of the step stool and turned to start walking, she didn't fall. She didn't come down hard, just normal movement. And her upper leg, her femur fractured. Wow. And it creates brittler bones. And that is a rare side effect, but significant and obviously scary, because it seems a little odd to me that we would want to prescribe a medication to reduce fractures, but it's actually increasing fracture risk. And now the consensus is that people really should not be on them for more than 3, a maximum of 5 years because of that.
Yeah. Okay. Well, also, then let me ask you, since the standard bone density test, like you say, is not very accurate. So what else besides that test? What else can people do to determine whether they have osteoporosis or not?
Well, that is the best way to determine it is that bone density test result. My comment on the limitations of the bone density test is in terms of how well it predicts fractures. It is still the gold standard in terms of diagnosing osteoporosis, and somebody could have a clinical diagnosis, meaning without that test, but it's less common. I mean, typically they're referred for a bone density test, and I think that's appropriate and that's important to get done. I think the more important question, though, is what test or what is better at predicting fractures, because that is only one piece of a much larger puzzle, that bone density test. And what we know is that consistently in the research, the best predictor of fractures is gait and mobility. How steady is somebody on their feet? Because 95% of fractures occur because somebody falls. So anything we can do to prevent falls by improving balance and strength is necessarily going to reduce fractures. The other thing that's consistently in the research that is a risk factor is polypharmacy, taking multiple medications because of what I mentioned before. Another consistent risk is falls. If you've fallen before, if you have a history of falls, then that is a risk factor for fractures. So a lot of these risk factors are modifiable, meaning we can change them. There are some we can't, like you can't change your age, but many of them you can change, like your diet and your exercise routine and your sleep pattern, because sleep is actually associated with, if you have insomnia, getting less than 6 hours a night, faster rate of bone loss. Yeah. So many things we can address.
Okay. Well, John, I have a short 60-second message, and when we come back, I want to just elaborate a little bit more on that, on what are some of the things that people can, not only to prevent it, but also to, what are some of the best treatments that you offer, and then we'll talk about a little bit more about what you have to offer on your website, your book, and your unique products. So we'll be right back here in 60 seconds.
Now, in just 17 minutes, you can get and stay fit and look and feel your best for life. This will be a life-changing and life-saving experience for you. Yes, it's true. Scientific studies have shown the Fast Fit 17 system is the fastest way to achieve maximum results in the shortest amount of time. This is a true fitness breakthrough. This system was developed particularly for busy people over 40 who know they need and want to get into better shape and have more energy, but feel they don't have the time. Now, time is no longer an issue. We want everyone to take advantage of this fitness breakthrough. So, for a limited time, you can get the entire program for only $17. So don't miss out. Order now at fastfit17.com.
Okay, we are back with Dr. John Neustadt talking about osteoporosis. So, John, let's talk just a little bit about what some things people need to be doing to prevent it, and then what are some of the natural treatments that you offer people. I know people should be doing weight-bearing exercises and talk about that and some healthy diet that they should be having.
Well, I think one of the things in terms of prevention is to make sure you get a medication review from your doctor and the pharmacist. Speak to your pharmacist, because doctors actually don't know all the medications that are damaging bone. And pharmacists can look that up on a database. So
Or maybe just get off some of those medications.
Well, ideally, if you can,
Yeah.
but I think the first step is to have a medication review. Obviously, if you can use holistic approaches, a naturopathic doctor, or a functional medicine doctor, whatever it is, to address those underlying health challenges you're having to get off the medications, you're going to be much better in the long run anyway. A lot of the stuff that is good for improving bone density, we still want to see that number go up despite the limitations of the test, and maintaining bone strength are the same things that prevent bone loss and that prevent you from developing osteoporosis and fractures to begin with. And that is diet. A Mediterranean style diet, a plant forward diet with plenty of protein. If you take your body weight and multiply it by 0.6, your body weight in pounds, that'll give you the minimum number of grams of protein you should be eating a day. The amount of protein you eat can account for about 3%, just that alone, of bone density. And also, it's protein, it's the collagen in bone that gives bone its ultimate strength and flexibility. Exercise, balance, things that you can do safely and you'll do consistently are very important to protecting your bones and maintaining and improving their health. Sleep, I mentioned. Dietary supplements are important, and when I could not find the doses of nutrients shown in clinical trials to work, 20 years ago, that's why I created my company, NBI. And because I needed solutions for my patients. Now, dietary supplements are not approved by the FDA to treat or prevent any diseases, but what they do is they powerfully push the biochemistry in the pathway of health to help bone grow stronger bone and maintain bone strength. So the products that I created for bone health, there are 3 versions of it. I've been so successful in the clinical trials, so successful at improving bone densities and maintaining strong bones that we guarantee that within 6 months of taking them, you will see your bone density either stabilize or improve. But more importantly, they will maintain strong bones. Meaning, if you break a bone, we will refund all the money for all qualifying purchases between your bone density tests. And then I've developed a collagen specifically for bone health and a unique sleep product to help people modulate their sleep. It's the only biphasic time release product in the country, and et cetera. I mean, there are other products that I created, but they all work in a holistic way to help push those biochemical pathways in a direction of health, to not only help with maintaining strong bones and improving bone density, but also just helping people to feel better, feel healthier, and be able to live more vital, energetic lives.
Well, that's so good. Yeah, I want to thank you for this great interview and also all the things that you're offering. I just have one more question, but first of all, I say we'll put this your website address in the description, the show description, but it's NBI Health, just nbihealth.com, where you can check out Dr. Neustadt's his book about reversing osteoporosis. You can check out all his great products that he has there. And one last question that I have for you is, would you say that just walking is a good enough weight-bearing exercise?
I love walking. So walking is associated, just 7,000 to 7,500 steps per day is associated with a 50 to 70% reduction in all-cause mortality. That's death from any cause, including osteoporosis. So walking is phenomenal. Absolutely huge fan of it.
Yeah, thank you so much for that. So the main thing here is you got to get out and move your body. You got to eat healthy food, and I highly recommend you go see a naturopathic doctor like Dr. John that would be, and get tested and know what your risk factors are and make a big difference in your life. So John, thanks so very much for being here. I really appreciate it. That was really some great information. And so I always like to end all of our shows with Einstein saying, knowledge without action is useless. So we always give you some good knowledge and wisdom, but you got to take action on it. So I hope you enjoyed today's show. Tell your friends about the Fearless Aging TV show. Thank you very much for being here.